Welcome. It is Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injuries. This is that one time, the one place every month that I will answer your questions. I will answer questions about injuries, surgeries, recovery, rehab, regenerative options, peptides, exosomes, stem cells, anything along those lines that you want to discuss. Importantly, this is not medical advice. I am not telling you what to do. I haven't seen you. I haven't examined you, looked at x-rays, MRIs, any of that. This is meant for general information and educational purposes only. If you have a question and you want to ask it in the chat, not in the comments below this video. If you're watching and trying to figure out where the chat is, look for Gargi's comment. He says, "Hello, doctor." Hi to you, and figure out where that is and ask your question right under it. Every single time after I do this show, I go online to do some things in YouTube, and I see in the comments that there were people asking questions. I cannot see the comments. I'm not actually in YouTube as I'm filming this. I'm in Ecamm, and it's sending it to YouTube. It's more complicated than it's worth explaining, but I can only see what's in the chat, and that's what's coming through. I will stay as long as there's questions. If you have questions, ask those, and I will stay as long as necessary. Sometimes that goes 20, 30 minutes or more. If it goes 2 minutes, if there's no questions, so be it, and we just come back next time. We are doing this a week later than normal. It's normally the first Monday of the month, but because of Labor Day here in the United States, I was not doing the show, so here we are on September 8th. Also, I say this a lot of times at the end of my videos, but because it's at the end of the videos, people don't know it. If you go down to the description under this video, I've written an ebook. It's a long one, many pages, lots of different things cited. It's called The Arthritis Solution. It's a number of different non-traditional integrative treatments for arthritis. There's modalities like hyperbaric oxygen, whole vibration therapy, whole body vibration. There's peptides. There's a number of different medications. There's regenerative options, but it's not just for people with arthritis. If you have any orthopedic injury and you want to hear about treatments other than cortisone shots, maybe other than physical therapy, although I am a big fan of physical therapy, you might find something in there that is interesting to you, and it may spur you to ask your doctor about your potential injury and, hey, would some of these treatments be right for me? Also, I don't use this show to promote my practice, but a number of people reach out to me saying, hey, I want to come to you to talk about exosomes or talk to you about penisin polysulfate or no steroid shots or physical therapy or surgery for this problem or that problem. What are my other options? And I am certainly happy to help. There's a link in the description below that takes you to my website. It'll take you to a form, very short form you just fill out, and you give me a little bit of information about what your potential problem is and some contact information, and I reach out to you sharing information about how to potentially set up an appointment with me. So definitely keep that in mind. I would love to help. I cannot do virtual consultations for people outside of the country at all, just so you know. And if you are in a state other than North or South Carolina, I can do a quick call by Zoom, but you're going to end up having to come to our office outside of Charleston, South Carolina for anything more than that, certainly for any treatments, because I only have licenses in North and South Carolina, and I only see patients in my office outside of Charleston. So just keep that in mind. All right, Mike says, can too high of an IGF level be harmful? There is theory, so let me back up and before I answer Mike's question. What he's asking about IGF-1 is insulin growth factor or insulin-like growth factor 1. It is what HGH acts on and increases to increase muscle size, to increase structures of bone, size of bones, and all sorts of things as you're growing, tendons and ligaments and things like that. As you get older, your HGH level production out of your brain naturally declines, and then your IGF levels decline. So whether it's a treatment like human growth hormone or it's a peptide such as CJC 1295 with ipamorelin or tesamorelin, there's a number of peptides that increase your body's production and release of HGH, but they're all going to act by increasing IGF-1, which is where the muscle hypertrophy and other factors potentially come. Yes, Can that be too high? Yes. Now, the debate would be how high and for how long does it have to be high before it becomes a problem. But yes, you want potentially to elevate it. You don't want to elevate it to sky high levels. Yes, potentially there's some anabolic benefit. There's some ergonomic or there's some performance benefits. But having said that, it does potentially get more dangerous, both in terms of potential tumor formation and some other issues. So even for providers that do use peptides that increase HGH levels or that prescribe various compounds to elevate HGH levels and thus IGF-1, they tend to want to keep it within a certain range and not super high. How high that would be, I think, somewhat of the debate. And whoever this is, Bees, can you see this? Yes, I can see it, and I put it on the screen. So if you have a question, yes, you put it in the right spot. But having said that, I think there is a lot of benefits to the peptides that raise HGH levels in terms of healing injuries. That isn't necessarily what's healing a tendon, ligament, or muscle, but if you support and help stimulate muscle growth around the area of the injury, a lot of times that takes pressure off the injured structure. So that in combination with something like BPC 157 can be very helpful. And so when you hear some of these peptide stacks for orthopedic injuries, that's why potentially adding something like CJC would potentially be helpful as a combination treatment for a muscle, tendon, ligament injury. I know a lot of people use something like CJC. They use things like HGH to increase muscle size, increase strength, increase muscle performance, and even potentially when you're talking about sarcopenia in older patients that are getting muscle atrophy and things like that, there are some potential benefits. Peptides are considered experimental by the FDA, not approved by insurance. So I am not telling you there's something that you should definitely do, but that is something that is an area, especially in the longevity world, that's being explored a lot. All right, those look like all the questions we have. So it's going to be a very, very short show this week. The next Ask Dr. Geier Live is on October 6th. And we'll go from there. Somebody got one in real quick. Paul says, are you familiar with lumbar? I'm assuming that's artificial disc replacement versus fusion. I don't do a lot of spine surgeries. Disc replacement, there's sort of a very limited window of who can do those, and then who, especially if the degenerative changes have gotten so bad that just doing a disc replacement is enough, and then they talk more about fusion, and they're for different problems. So that is where that comes from. All right, now the question. All I have to do is threaten to end the show, and the questions come. I had surgery on my shoulder 4 months ago, torn labrum. How do I know if it's fixed without getting another MRI? A lot of it would be, I guess, first of all, what the symptoms were before. If it was a labral repair versus trimming part of it out. If it was for instability, the shoulder, the ball popping in and out of the socket, is it doing that anymore, or even feeling like it's going to, rather if it's just pain? And then part of it too is if it's a repair, then you're waiting on those stitches and anchors to heal the labrum in place. If they just went in and trimmed part of the labrum out, that's a pretty simple recovery, and so there you're just looking to see if the symptoms got better. But it really depends on what it is. If it's pain, then yeah, you're waiting for the pain to get better. The trick with labral repairs, again, sewing the labrum back down, is that it's a long process to get motion and strength back, so it can be tricky, a long time to get back to your normal activities before you can really tell if it did what it was supposed to do. Robbie says, is that Robbie? Did I say that right? Robbie? My MRI doesn't show tears. Will I be able to walk normally eventually? I don't know what the tears of what are, so it would depend on, without knowing more. I would hope so. If an MRI of whatever lower extremity body part was fairly normal, yes, you would hope you get back to full activity, but without knowing symptoms or anything like that, it's really hard to say. MRIs show you structural damage. Ligament torn, tendon torn, muscle tear, cartilage damage, things like that. It doesn't show pain. And that's one of the things. It is very good at showing structures, but a lot of times that can be misleading because it may show you a bunch of stuff that isn't necessarily the source of pain, or you don't know what part of it is the source of pain. And it can you can have pain and have no structural damage. So they're not always perfect in that sense. It depends. That's where taking the history, the patient's symptoms and how they got hurt and things like that, adding the physical exam, testing all the different structures to try to figure out what it is, and then using X-ray and MRI to look for structural damage related to what you suspect based on history and physical examination. Started putting heat on it again without knowing what the injury is. It's hard to say, but generally orthopedic surgeons like cold to try to reduce inflammation, reduce swelling, whereas heat tends to increase that. But there are some uses for heat, especially to warm up muscles like before physical activity, but generally most orthopedic surgeons like cold. All right, that looks like it. So we will conclude. I will be back October 6th. I very, very much appreciate you being here. Thank you very much. And again, check out that ebook. The link to that, it's completely free. The link to that is in the description below. And if you are interested in potentially seeing me as a patient, there's a link to that as well. Thank you so much, and I will see you very soon. Take care.